Hi everyone, I am Nokutula, India, the occupational therapist for the Department of Education based in Craddock office. I'm qualified from the University of the Western Cape in Bachelor of Science, OT, with Master of Science in OT from the University of Witwatersrand. I worked both in public and private sectors. I worked both locally and abroad in East London Hospital Complex. I worked in Durban Life Health, Entabeni Rehab Hospital. I worked for the Gauteng Department of Health, and I also worked overseas in Saudi Arabia. I've been practicing as an OT for the past 16 years. I'm very passionate about my profession. I love and enjoy working as an OT. As I've said, I'm currently based at the Department of Education District Office, Craddock, with the purpose of management of OT, department and community therapy services in the allocated areas. I conduct school, home and community visits for OT services. In my area of work, I undertake management and administration tasks as required and still treat clients hands-on. I provide occupational therapeutic services. These are in terms of assessments and treatment for clients with different pathologies. For example, mental health illnesses, psychiatric conditions, intellectual disabilities, learning disorders, neurological conditions, disabilities for pediatrics, substance abuse, congenital deformities, visually impaired, and so forth. The community-based rehabilitation. Here we make decisions on school placement for learners accordingly. Offer counseling services and occupational therapy management to pediatrics, adolescents, and early adulthood individuals. Alliance with the Department of Health, Department of Social Development, and that of Justice for possible and needed interventions. The Bachelor of Science in the field of occupational therapy degree aims to skill students in helping clients who are temporarily or permanently impaired by illness, accident, disability, environmental limitations, or developmental delays. Occupational therapy is the therapeutic use of self-care, work, education, play, leisure, and social activities to increase independent function, to enhance development, to promote health and well-being, and prevent disability. Occupational therapy is indicated when people lose their ability to carry out their everyday activities. As occupational therapists, we study human growth and development and persons' interaction with their environment through their daily activities. OTs are experts in social, emotional, and physiological effects of illness and injury. This knowledge helps us to promote skills for independent living in people with challenges and children with developmental disorders. You study OT at the university. This is a bachelor post-admission criterion. Most South African universities do train occupational therapists. However, currently there is no university in the Eastern Cape province that trains OTs. I'm saying currently because we are planning to open occupational therapy studies in one or some of Eastern Cape universities. You can study in the following universities: UWC, VETS, UFC, UCT, University of Stellenbosch, University of Pretoria, University of Limpopo, formerly known as the Medunsa, in Teflo, University of KZN or KwaZulu-Natal. The subjects that are needed for you to study OT, in most universities, an admission requirement is a national certificate as certified by Umalusi. With the entry into a bachelor degree, level 4 pass is preferred in the following subjects: sciences or life sciences and or physical therapy, mathematics, English, home or first language, additional language. The course covers a period of 4 years of full-time study. It is designed to obtain active participation and learning from the student. The students performed clinical practical work at several clinics, some bodies or NGOs, and hospitals, as well as in the community. When you qualify in BSc OT or Bachelor of Sciences Occupational Therapy, you study the Faculty of Health Sciences, duration for 4 years, then in the School of Therapeutic Sciences. Occupational therapy is a stimulating career, offering ever-present challenges. It requires an adaptable, intelligent, and practical person with good problem-solving and managerial skills. The successful occupational therapist has good interpersonal relations and can approach divergent situations in a resourceful manner. Qualified OTs are registered with the Health Professions Council of South Africa. The Occupational Council for Occupational Therapists regulates the training and work performance standards. Career opportunities are both local and international. The good news is that the full-time 4-year study is followed by a year of community service for the Department of Health in South Africa, meaning you have a guaranteed employment after graduation. After completing community service, you will be eligible for registration as an occupational therapist with the council. As an occupational therapist, you can work at aged care facilities, community health centers, home care services, hospitals and rehabilitation centers, independent living and respite centers, private practices, psychiatric clinics, schools, and education facilities. You can also work at the vocational rehabilitation centers. Thank you.